Good afternoon, this is Dr. Do again. This video is one of the series of videos talk about the symptoms or problems that you need to either see emergency department or call your physician or manage at home. Today's topic is on anemia. Before we talk about the anemia, let's talk briefly. I will just give you some idea. What's the component of the blood? Okay, so the blood, you all know, is circulating the blood vessels from heart, left heart, through the lung for exchange, get rid of the carbon dioxide and bring the new oxygen to supply the body. So the blood has cells, white blood cell, red blood cell, and also another platelet, which is responsible for coagulation, and also the liquid form for the blood. You all know that it's plasma. So the red blood cells is the major cells responsible for oxygen transportation. Okay, so basically, like I said, the blood through the lung, circulate in the lung, and pick up the oxygen and release the carbon dioxide. That's why we breathe out the carbon dioxide. And the blood from the lung, which carrying rich of oxygen to supply to the body, to release oxygen to the tissue for metabolism. And this function is carried on by the red blood cells. Particularly, there's a protein called hemoglobin inside of the red blood cells to finish this function. So anemia is either you have decreased red blood cells from the bone marrow, which cannot produce red blood cells, or the component of hemoglobin is low. So that's because low of red blood cells or hemoglobin, so the oxygen in the body is low. So that's the bring us the definition for anemia: decreased red blood cells or hemoglobin. What kind of symptoms? Usually it's very subtle. You probably cannot feel it. You do not know you have it. Some people might show pale if you and fatigue, which means always feel tired, extra sleeping, or malnutrition, did not eat well, just trying to lose weight too much, especially for young people. Try to look good, so limit the food intake, then just increase the risk for anemia. So what kind of causes for anemia? Either the body does not produce enough, or through the losing, either damage, the blood cells broken, or lose outside the body, bleeding. Okay, so then what kind of symptoms, what kind of problem you need to visit the emergency? Like I said, bleeding from injury, trauma, this is definitely you need to see the emergency, or the bleeding from your vomit, you vomit up blood, or coughing up blood, or through the stool, diarrhea of blood, or you have the bright red blood per rectum. You just have the move out your bowel movement with blood. It's fresh and red, or there's a special cause called the tar stool, which is black. That means your blood is coming from the upper digestive system, processed by the enzymes, so it's just the color change to dark. So if this is the case, you also need to see the emergency. Okay, so what kind of symptoms you need to call your physician? You look yourself through the mirror. Oh, I look pale. You lost a lot of weight. Okay, and your friend told you, hey, you look pale. It's not just 1 day, 2 days, or 1 week, 2 weeks, 1 month, 2 months, but continuously. So that's the case, and you feel fatigued, tired. That's definitely you need to call your physician. And anemia is no way you can manage at home. Okay, so this for anemia, regardless of what, call your physician or visit the emergency room. So I will talk about special scenarios It's very subtle, it's very easy to be neglected until the later stage. One of them is the colon cancer. Okay, a lot of time colon cancer is diagnosed because of the anemia. Okay, our patients feel tired, especially older patients haven't had the colonoscopy for a while, and feel tired, easy fatigue, and look pale, and regular physical exam, yearly exam, test the blood, have the anemia. So the doctor do the whole workup and ask the family history, the exam, and the imaging study, and eventually find out there's a cancer tumor in the colon. So this is one of special scenario. So if you're older than 65 years old, you have on cause of pale, fatigue, and anemia, then that's one of the alert. The other one, the other cause for anemia is vitamin related. Could happen to everybody. It's called vitamin B12 deficiency. Okay, associated with folic acid deficiency. So these are to happen to those people, vegetarians, do not eat a lot of animal proteins, and the symptoms is usually, like I said, pale, fatigue, and for vitamin B12 deficiency, you could probably have numbness and tingling. The nervous system is involved. For folic acid deficiency, you may not have nervous system, but the same symptoms related similar to the vitamin B12 deficiency. There's a special case. The stomach problem can cause a vitamin B12 deficiency. So if you have long-term gastritis, chronic, you feel always uncomfortable on the upper abdomen, and you lost weight, you look pale, and I recommend you to call your physician to check out, to make sure you do not have that special type of pernicious anemia. Okay, because there's intrinsic factor secreted by the stomach facilitate vitamin B12 absorption. If you have that problem, then vitamin B12, even though you eat proteins, you eat vitamin B12, that cannot be absorbed. So that's the pernicious anemia. If that's the case, you need to call your physician to schedule appointment. So actually, there's so many causes that probably you can search out the website if you have symptoms. There's so many reasons for anemia. I may next time individually talk about the major one. Okay, so this is this video for general introduction of anemia. Thank you for watching, and I'll see you next time.